Hi, my name is Stephanie Ford and I'm a physician assistant here at Saline Heart Group. Today we'll be discussing the topic, what is heart failure? Heart failure is a condition that affects more than 5.1 million Americans, and this is based on data from the American Heart Association. It increases with age and is associated with an increase in hospitalizations. So what exactly is heart failure? A very simple definition of heart failure is when your heart no longer pumps blood or fills with blood the way that it should. The heart is not functioning properly, which causes problems in other parts of the body. This is why so many people with heart failure have particular symptoms including shortness of breath, coughing, swelling, and fatigue. Some people can't even lay down flat to sleep at night and have to sleep in a chair or propped up on pillows. All of these signs and symptoms may occur, or you may just have a couple of symptoms, but either way, it's important that you're monitored closely. There are two common types of heart failure, and we will discuss both. It is important to note that you can have the same symptoms with both types of heart failure that we will discuss today. Before we discuss each type, you will need to know some terminology. First, we'll talk about ejection fraction. The ejection fraction is the amount of blood that's pumped out of the ventricle or the bottom chamber of the heart during each heartbeat. This is talked about as a percentage. A normal ejection fraction is considered to be 55 to 60%. We calculate an ejection fraction when we perform tests like an echocardiogram. Your ejection fraction or EF can change or decrease during a heart failure exacerbation or episode, and because of this possible decrease in EF, we may take multiple echoes over the course of your treatment. This allows us to see if our treatments are working. When your EF does decrease during a heart failure episode, we call this heart failure with reduced ejection fraction. Sometimes people have all the signs and symptoms of heart failure, but when we perform an echo, we see that their ejection fraction is still normal. This is heart failure with preserved ejection fraction, and this occurs when people have no change in their EF despite being in heart failure. It's helpful to distinguish between the two types of heart failure so that we can treat you appropriately and schedule appropriate follow-up visits. Another important question is, how do we treat heart failure? A lot of this can be very patient dependent, but overall we follow guidelines by the American Heart Association that recommends that we use medications shown to improve heart failure. This is tailored individually to each patient based on things like the patient's blood pressure, heart rate, if there's been any weight gain, kidney function, and what symptoms the patients are having. It's important for you to tell us exactly how you are feeling so we can do our best to help make you feel better. It's very important that if you have heart failure, you're monitored closely. You may be coming to the office more regularly as we're making adjustments to your medication regimen. We want you to be involved in your treatment and help us monitor your symptoms as you begin to feel better. We've discussed signs and symptoms of heart failure earlier, but one particular thing always stands out as an important way to monitor your improvement. We ask patients to keep a close eye on their weights and monitor if they begin to notice a weight gain. This helps us know if we're providing you with an appropriate dose of a medication called a diuretic, or a lot of us know them, a water pill. This is not the only medication we use to treat heart failure, but this is a medication that can be adjusted quite a bit as we're trying to find the right dose for you. I hope you've learned a lot more about heart failure through our talk today, and if you have any further questions about heart failure, be sure to speak with your provider today.